So this is the student end of the logbook. So every time they click on a module, a new line will be created in their logbook so they can see how they've done, what their best practice score was, best test, quiz, etc., and how long they've accessed the module. We would definitely hope to see that maybe the first few times they access the modules, the score is really low, but it will come up as they start to work through the module more and more. They can click onto the line and see detailed report as to how they've done. So to let them know the simulation steps that they've gone wrong on. And that way when they rework through that module, hopefully they'll be able to really pay attention to those steps and get to that mastery level. We also have the detailed report, which will bring them into the details for this particular procedure. So to let them know every time they've accessed the procedure, the steps they've gone wrong on, when they first started the procedure, how long it took them. And again, here we would definitely hope to see that the sessions at the top, the more recent accessed modules, scores will be a lot higher than the ones maybe towards the bottom of this list. The more they're in here working, the more likely they're going to be able to get to that mastery level. They can use this to work off, study off of, and really pay attention to those procedure steps that they may have gone wrong on the first time around. So this is the detailed report. The summary tab that you're seeing here, students must complete a test simulation or to get a score here. But again, every time they complete a test simulation, their score will be logged here. And if they do get an 80% or above on that particular test simulation and spend at least 60 minutes within the module, they actually do earn a certificate, which they can download to their computer. And some instructors will actually have students download the certificate, maybe, print it, bring it to class the next day, and this is their ticket into lab time, just stating they got that 80% or higher and spent an hour in the module. The thought being students who do complete the simulations before lab tend to use less disposables as they're able to complete the procedure during lab time in 1 or 2 tries versus maybe 4 or 5 tries for a student who had not taken the time to work through the SimTics module before their lab time.